the natural response to trauma is based on the mind becoming hyper vigilant. So what trauma does is that it raises the level of vigilance, of alertness, of awareness of our mind, and therefore things that would have passed our mind before, that includes memories, events, situations that could have passed our mind without attention, becomes very significant, and also it affects trauma affects the way our mind processes information, so that information is processed but not completely processed, and we start to reprocess the information again and again and again without the kind of completing the process, and this gives rise to a lot of psychological symptoms. So our emotions become very intense, and then this includes anger, fear, panic, emotion of feeling apprehensive, and this psychological response may then lead to other forms of response. For example, a physical response, such as difficulty with sleep, energy levels, appetites, and but the main psychological response to trauma is based on our central nervous system and our general mind being fired up in a state where we are too alert, hypervigilant, so that things are not put to rest. Things keep circulating on our mind, and this gives rise to a whole lot of symptoms that we can then associate with trauma. There really is no measure of severity. For the purpose of diagnosis, we used to think that for a trauma to cause psychological response, it has to be of a degree that the average person would respond to. But actually, there is no average person. So what may seem trivial to one person may become very traumatic to the other person. And what matters here is that the person's own perception of the threat that event or situation posed to them, and therefore situations like a major road traffic accident, or earthquake, or volcano may generally provoke trauma in majority of persons who witness it or has the potential to do so. But equally, trivial events like witnessing somebody beating up someone on the street, or someone exposing your personal information can be just as traumatic to certain individuals. So there really is no official measure of how severe trauma should be to provoke psychological response in any particular person. Different, again, it goes back to my understanding of trauma. I always look at trauma as a condition where anxiety is very prevalent, and therefore, when you look at the response to trauma, you look at the physical, the cognitive, and the psychological. Take for example, the psychological, it's your mind is fired up, you become hypervigilant, and therefore your anxiety levels are much higher. Everything becomes frightening to you, and everything becomes threatening, and this determines a lot of the psychological response to trauma. And then this threat that we perceive from situations and memories leads us to avoid situations. So we avoid situations and that we previously might not have considered to be threatening. And when that avoidance doesn't solve our anxiety or panic, we may then seek to medicate our anxiety by taking some drugs and alcohol or substances. So that is the psychological part of trauma. there is also the physical, that we start to suffer symptoms like racing heartbeat, a pulse racing, we're sweating, we're having tremors, we may lose appetite, we start to feel stomach problems, we may start to even feel problems with our joints, and some people may pass out. Now, these are all physical responses to trauma. And then the cognitive, which is the thinking, is what we believe or associate with situations. So situations that we previously may not have paid attention to, we start to perceive them as frightening, and we think in our mind that these are frightening. We allocate or apportion a lot of threat and dangers situations that may have been trivial before. And so this complex of physical, psychological, and cognitive responses make up the illness that we come to identify as trauma response illnesses, such as post-traumatic stress disorder, adjustment disorder, acute stress reaction, or even complex post-traumatic stress disorder. Again, there is no length, no definitive length no definition of how long trauma should affect us in our lives. For the purpose of diagnosis, some people may set an arbitrary cutoff point, but I do not believe there's a cutoff point. Our response to trauma may change over time. For example, a person who suffers with post-traumatic stress disorder in the early days or 6 months of the trauma may go on to develop long-term adjustment issues. And equally, post-traumatic stress disorder itself may be delayed for several months or years. And therefore, there is no length in terms of how long trauma should affect our lives. What matters for the clinician, for the trying to help the patient, is to try and listen to the patient and identify those symptoms that may be connected to trauma. And even though the symptoms may now have given rise to other illnesses like depression and chronic anxiety disorders, or even substance misuse, but if you listen to the patient, you may be able to associate this the patient's symptoms. Even if many years have passed, you may associate the symptoms with the trauma, and that allows you to help the patient in that way. So yes, there is no, or I'll say no, there is no limit to how long trauma should affect our lives. But what is important is for us to be able to see there's a connection between trauma and the current symptoms of the patient. As what we severe trauma, I think again severity is a very individual measure. Severe, and you can call it severe or complex, but severe trauma may require more than one type of intervention. For example, severe trauma may manifest as post-traumatic stress disorder, but it may also be associated with other conditions such as depression and other forms of anxiety, or even substance misuse, or it may even lead to so-called complex PTSD, which may include self-harm. So the treatment for severe trauma is based on trying to identify the actual illness, because trauma itself is not an illness. It's the response to trauma that is an illness. So to identify the illness that trauma has given rise to, and look at how can those illnesses be treated. I do not, as a doctor or a psychiatrist, I do not believe in giving one diagnosis that may explain 100 different symptoms. I try to explore the patient's own history and find out how the trauma may have given rise to a reoccurrence or relapse of previous illnesses. For example, a patient who used to self-harm has now suffered trauma, and she's now self-harming. And I should be able to identify the relapse of the previous illness, in addition to the PTSD or other forms of trauma response. Equally, a trauma patient can become depressed because he or she may have had a history of depression. again, it's important to treat the trauma, but also important to treat the depression that that person has suffered a recurrence because of the trauma. The same applies to people who may have taken to drinking and taking drugs and developed a substance dependence. It is no help to the patient if you just treat their trauma without paying attention to the fact that they are now dependent on alcohol and other and drugs. So yes, complex trauma or complex severe trauma needs a complex response. The response may include medication. It may include psychological therapy. And for those who have been out of work and suffering loss of earning, it may include giving them a pathway towards employment and rehabilitation, and be able to form new relationships and be able to feel fulfilled. So the treatment for trauma, in my opinion, must be robust and comprehensive, and maybe it may include medication, psychological, occupational, and other forms of treatment.